Hello, I'm Professor Q, and welcome to QPI's Lavear Harp Light Technology software demonstration for durable medical equipment providers. I'm glad you're here. Let's get started and explore how this powerful platform can streamline your compliance, simplify your workflow, and strengthen your business from the ground up. QPI's Lavear Harp Light Technology. Welcome to the Lavear platform, your centralized solution for managing human resources, administration, risk management, and patient outcomes, all in one secure system. The login interface is simple, secure, and designed for ease of access. Once logged in, users can seamlessly access their dashboards based on permission level, ensuring protected access to sensitive compliance and operational data. Powered by QPI Healthcare Services. Trusted by DME providers nationwide. Lavear's intuitive left-hand navigation panel puts everything you need right at your fingertips. Designed for quick access and seamless workflow, it organizes key operational categories into a clean, collapsible menu structure that lets users jump between functions without losing context. Core features include Client Profile Overview, Provider Type, Program Manager and Program Coordinator, NPI, PTN, EIN, Accreditor, etc. Quick links to human resources, revenue calculator, and administrative docs. Credential Snapshot for survey readiness. Navigation tabs for clients, affiliate access, and management tools. Every section is logically grouped, so your team can spend less time searching and more time working smart. Welcome to the Administration tab in Lavear. Here, you can quickly view and update all company-specific details, organized by category and tailored to your provider type. From authorized officials to serviceable states, usernames, and program managers, everything you need is available at a glance, so your team stays informed, aligned, and always audit-ready. Lavear keeps your business organized, accessible, and compliant, every step of the way. Once we begin collecting your data, this is where your dedicated program manager will initiate the onboarding process. Please note that onboarding can take several days to complete, as each item presented in the following slides must be carefully reviewed, validated, and cross-checked against your actual supporting documents. This ensures accuracy and authenticity in alignment with regulatory standards. As we progress through the onboarding process, we will identify all associated affiliations and confirm the designated authorized official responsible for your organization's compliance and credentialing activities. In this organization, there is only one designated authorized official. Stella Woohoo. All official correspondence, contract approvals, and regulatory verifications must be processed through or signed by the authorized official on record. We ensure all credentialing, payer enrollment, and compliance documentation reflects this designation. Identifying all authorized officials is a critical step in the onboarding process. These individuals must align with those listed in the organization's articles of incorporation. This verification is conducted at this stage to ensure consistency and compliance with governing documentation. It's important to note that the authorized official's information is treated as confidential and is safeguarded with back-end security protocols to ensure privacy and data protection at every level. It's also important to note that if your organization has an office manager, they must be listed as a delegated official, both within this system and on all payer enrollments. This designation authorizes them to communicate with surveyors and accrediting bodies on your behalf in the event you are unavailable. Your dedicated program manager and program coordinator are responsible for overseeing your organization's administration, compliance, task management, and overall operational health. They serve as your primary support team throughout the onboarding and beyond. As part of Medicare requirements, your organization must maintain a minimum of 30 hours of operation per week. This section is where we track and verify that information. Please be aware that our team may conduct random calls to your office to confirm compliance with this requirement. At a quick glance, this section allows us to add, update, or remove services in state locations based on your payer enrollments. It is critical that this information remains accurate. Providing products or services in a state not listed here could result in a false claim submission to Medicare. placing your organization at serious risk for noncompliance. During your onboarding process, your program manager will generate over 90 custom tasks to initiate the compliance implementation for your company. We'll review this in more detail later in the demonstration. We also account for your specific time zone to ensure all tasks and communications are appropriately aligned. In addition, we securely store all usernames and passwords for key web portals, such as the CMS INA Management System, NPI Registry, and others, so you'll never have to guess which portal to use or what your login credentials are. The General Notes section is designated for non-standard communications. This includes important details such as your distributor and manufacturer information, which may not be captured in other standardized fields, but are essential for your operations. Task management is a vital component of our virtual administration model. As mentioned earlier, we generate over 90 tasks within the first 30 days of service and continue building from there to ensure that nothing falls through the compliance cracks. Each task is highly detailed and directly supports our push technology protocols, while also facilitating the collection of key performance indicators, KPIs, for reporting to insurance payers, accreditation surveyors, and regulatory bodies. Now that all tasks have been built within the administration section of your Lavear web portal, you can clearly view your real-time compliance status. When your organization is fully current, you'll see a 100% compliance rating. As tasks approach their due dates, the green HARP light meter will begin to decrease, serving as a visual prompt to take action and avoid falling out of compliance. Additionally, you will have full, real-time access to your account. All updates, progress notes, and team communications will be visible through your personalized news feed, ensuring transparency and continuous engagement. Since this is a new client onboarding, we will now begin walking you through the Human Resources section of your Lavear web portal. Please note that at this stage, all HARP light meters within the Human Resources module are currently at 0%, indicating that compliance tracking has not yet begun. This will change as we input data and complete the onboarding steps. Now that Stella has been officially set up as an employee of the company, we will begin uploading her supporting documentation. This includes her employee file, education credentials, and background verification records. As we begin onboarding Stella, woohoo, you'll notice that the HARP light meters have started to fill in. This visual progress reflects the completion and real-time tracking of compliance components within the system. The HARP system is driven by expirable dates and is continuously monitored for accuracy. As a due date approaches, the corresponding HARP light meter percentage will begin to decrease, serving as an alert that action is needed to maintain compliance. If we navigate back to the client dashboard, you'll see that the overall health of the company is beginning to take shape. This reflects increasing compliance accuracy as key components are completed and integrated into the system. We are now reviewing the risk management department of your company. In this section, we'll take a closer look at payer enrollments, including Medicare, Medicaid, state licenses, and your commercial insurance contracts, all essential components for maintaining compliance and reducing operational risk. Let's begin with a Medicare application. When QPI initiates a payer enrollment on your behalf, typically starting with Medicare's CMS 855S application, you'll be able to track the entire process in real time through the Credentialing Application Tracker, also known as the CAT. We'll walk you through this feature in detail in the next few slides. As part of the enrollment process, we begin collecting essential data for future use. This includes payer representative contact information, plan-specific details, mailing addresses, and other key elements needed to support credentialing, renewals, and communication with insurance networks. By securely housing all of this information in one centralized location, you eliminate the risk of losing critical data, ensuring continuity, accessibility, and compliance at every stage of your business operations. We currently have 3 applications submitted for this provider. Medicare enrollment application. Florida State Medicaid provider application. State of Florida Home Medical Equipment, HME, license application. All applications are in progress and pending review by their respective agencies. Updates will be provided as status changes occur. By clicking on the graphical report, you'll be able to view the real-time progression of all credentialing applications. This visual tool provides a clear snapshot of each application status, helping you stay informed and on track throughout the enrollment process. Within the risk management section, you also have the ability to report changes or notify us immediately if a surveyor is on site. When a surveyor arrives, you'll have direct and immediate access to your program manager and the QPI leadership team for real-time support. What you're seeing now is the Report a Change screen, your central hub for urgent updates and compliance-related notifications. This is where you can quickly report that a surveyor is on site. Submitting this alert will immediately notify your QPI Program Manager and activate real-time support from the QPI leadership team. We're here to guide you every step of the way. Now that we've added all of your organization's risk management data, scrubbed, validated, and fully audited, your risk management HARP Light meter has reached 100% compliance. Risk management documentation includes critical elements such as your ethics committee appointment, professional advisory committee records, facility safety inspection reports, and more. QPI is responsible for the preparation and deployment of these essential documents to ensure your organization remains fully compliant. Now that we've entered the patient outcomes section, you'll notice the HARP Light meter is currently at 0. This is expected at the start. The meter will begin to illuminate as your organization begins to collect and submit patient satisfaction surveys, contributing to your overall compliance and quality performance metrics. The General Forms and Information Hub serves as your central command center, showcasing tasks, form requests, system notifications, live chat support, and access to help documentation. This all-in-one hub ensures you stay informed, connected, and fully supported throughout your compliance journey. Lastly, let's talk about your knowledge base. As we get to know you and your practice, we'll continue to expand this section with tools and resources tailored specifically to your operations. To get you started, we've included the QPI DME Revenue Calculator, available for immediate use. This tool is designed around the DME POS fee schedule and will help you estimate revenue potential with accuracy and ease. This calculator is available for all DME products and services, giving you a comprehensive tool to project reimbursements, evaluate profitability, and support informed decision-making across your entire product line. Thank you for taking the time to visit our virtual DME administrator. We're excited to support your journey. Let's get started today.